All right, thank you, Leon, and thanks to everyone. Today I have with us Dr. Blaine Mire, who has truly been an asset to the task force for the city of Natchez. He's actually helped us uh, to adopt the necessary policies uh, that we have in place in the city of Natchez in order to help to reduce the spread of COVID-19. So I will let Dr. Muir say good evening in his own way and just give us an overview of this virus, Dr. Muir, to help the listening audience to understand how is it that this virus operates.
Well, good evening, everyone. Thank you, Mr. Mayor, for having me on. It's an honor to be able to talk to you guys tonight. So, we're all living this thing together, and we can go back, over a month, almost 6 weeks ago when all this started. So everybody is doing what they have to do in our community to keep themselves safe. And from my perspective as a medical physician, talking to my patients every day, I just want everyone to know how much we appreciate it from a medical side, that most of our folks are listening and doing the right thing, staying in place, staying at home, and protecting themselves when they get out in public. Because when they protect themselves, they're protecting others. And this virus is an incredible insult to our community. We've never seen anything like this. And basically, you guys have seen this over and over on the TV. We've inundated with it 24/7, so I don't have to go through the whole history of this virus, but recognizing that we have this particular pathogen in our community, in all of our communities, where you can't see it, and we have to do everything we can on a day-to-day basis. That seems to be, I know it seems to be so overkill. It seems to be such a inconvenience to our lives. But I think what's happened over the last month, Mr. Mayor, is that most of us out there knew it was a danger. We were preaching it, and for everyone to do the right thing, and we certainly understand that other folks didn't see it quite as the threat, because it's silent, you can't it's invisible, and a lot of folks out there that are young and healthy may or may not have been exposed to it and weren't getting sick. But what we found is, over time, over the last 3 or 4 weeks, that because it's so insidiously moved through the community, that more and more of our older folks that may have also had some pre-existing conditions, diabetes, hypertension, heart disease, COPD, asthma, other immune compromised states, that when those folks were accidentally exposed to it, that's when bad things can happen. And we have unfortunately experienced that in our community, just like anywhere else. And I think once we've seen that occur, and we've seen our hospitals fill up with very sick patients, that everybody got on board with understanding what we needed to do. So we've come through quite a bit of that storm. I'm happy to say tonight that I can say that I really do believe, with all the measures that the governor put into place, and that you so rightly put into place as well in the last few weeks, and with your added support about a week ago, when you added those additional measures for the essential services, that we are starting to see this thing flatten out. We were supposed to reach the peak over the weekend. Matter of fact, April 25th was the date that the University of Washington model that we've been talking about for weeks had Mississippi pegged to reach a peak incidence. And unfortunately, that incidence is death rates. But those, thank God, the death rates that were predicted several weeks ago were not met, and we're way below those rates. Any death is too much, but we're way below the rates that were predicted. And now it does appear that we're flattening out, and that means that curve, instead of a trajectory, could start to trend downward. I say this very optimistically tonight, Mr. Mayor, because I believe that we are there, and if we continue to keep our measures in place that we have to protect our more vulnerable community members. And we do this for now an extent that we still have to extend this out. Because look, if we have met that peak and we're flattening out, it takes at least 2 weeks of a constant decline in a viral pandemic like this to have any confidence that we are on the road to that recovery that we've been really hoping for. So I'll stop there so you can ask me some
So
more
it's
questions.
really important. It's really important for people to understand that they need to continue what they're doing in order to prevent an inclination that is a rise in the spread of this disease. I mean, I heard you mention that you think that we possibly have reached our peak and, it's kind of flattened out. But it's important for people to understand in order for that phase to go into a phase of declination to decline in terms of the spread and the prevalence of the disease, that people need to continue those practices that have been instilled in them for the past 6 weeks, correct?
No, absolutely. This peak and this model is all based on what we're doing. This thing is like a living, moving organism itself as a model, because the model is just set as a prediction based on all the data that comes into the model, and the data is based on what we're doing. It puts into play all these stay-at-home measures and social distancing and masking and hand hygiene that we've been doing. And if we stop this abruptly or reduce it significantly now, then just like you said, we're looking at another potential bump in that curve and extending out all the problems that we've been having much longer than they need to be.
So, Dr. Mire, you've described this virus as being invisible. And of course, it's a microbe. You can't see it with your naked eye. You can't smell it. You can't taste it. You can't feel it. And it's important for people to understand that there are universal practices that must be implemented and utilized by people in order to prevent themselves from being contaminated or infected, and also to reduce the spread. And that's the importance of good old-fashioned hand washing, good old-fashioned keeping your hands away from your faces. Also, masking. Can you talk about why it's important and why we've been encouraging people to wear masks when they go out to get their essential goods, such as to a supermarket, etc.?
Yeah, sure. Look, this virus, just for everybody to be reminded, this virus is just a little simple single-stranded RNA virus. It's not really even a living, breathing organism. But it does come into our systems, takes over our own cells, and then replicates. It reproduces itself by basically hijacking our own system. And so it moves into our system through mucous membranes. That's your eyes, into your nose, through your mouth. Now, how does it get there? It gets there through droplets, just basically water droplets. Where do the water droplets come from? They come from when you sneeze or when you cough. So the virus doesn't just start floating around in the air and just float around for a while. It's in droplets. These droplets can float around in the air for a few minutes, sometimes longer, and they can also spread several feet. We think 6 feet. We say a really strong sneeze could be even further, but it's unlikely once it spreads any further out that it's going to be able to stay focused in one area. You would have to walk right into there and stay in that area for an extended period of time. But look, what a mask does, it not only, if you're wearing a mask, and let's just say you have minor symptoms, you're a young person, you don't feel that sick, but you're dealing with a lot of coughing and sneezing, you're blaming it on allergies, but you feel fine, maybe you feel a little run down, that could be COVID-19 by itself. If you walk into a store and you go, no, I'm not wearing a mask, I'm not going to get sick, I'm too cool for a mask, then if you cough and sneeze in front of somebody that is doing everything they can to protect themselves. Let's say they have a mask on, a cloth mask on. Well, the problem is a cloth mask or a surgical mask would not protect them from your sneeze or cough if you weren't wearing protection. But if you're wearing protection and you walk in and you have COVID-19 and you're coughing and sneezing and you have any type of mask over your face, you are immediately protecting others from you. And that's the real key here. You're protecting others from you. Listen, and then take it a step further. If you're wearing a mask into a store, Mr. Mayor, and you're going to remember these droplets, if people are coughing and sneezing even before they come into a store, they may have some of those droplets on their hands. And then they go through a grocery store and they touch on the bread and touch on their tomatoes and touch on things. Oh, I don't want that. I'm going to get this one. And they find their way through a store. They've left potentially left droplets of virus with virus in it all over that store. So if you go in that store and you go through and you pick that tomato and that loaf of bread and other items and you go through that store, and as long as you do not touch your face with your hands and you check out and you get outside to your car before you go to get to your car, and you cleanse your hands thoroughly with some type of sanitation gel with at least 60-65% alcohol, that virus is not going to survive on your hands and you're going to be fine. But if you are in that store and all of a sudden you got to scratch your face, you got to itch your nose or rub your eye, and you've touched on these items, you may inadvertently be putting that virus into your mucous membranes of your face, and that's how you come down with the virus. Wearing a mask, if nothing else, when you wear a mask, you're protecting others from you. But it's also a really good reminder when you're in a store and out in public not to touch your face. And and if you do touch your face, you may be touching the mask itself instead of your face. So that's a really good protective measure as well. So if you think you left the store and you've touched on your mask, then you can cautiously remove your mask when you get to your car, put it in a safe place or out of the way so you don't touch it, and you can still clean your hands, but your face has not been contaminated. And the cross contamination from the store and all the items you touched don't make it from your hands to your face, and that's how this thing spreads.
Dr. Mire, I really appreciate you explaining that to the audience out there, because it's important for people to understand how this virus is being transmitted. It's important for people to understand the importance of hand washing or using a sanitizer, and more importantly, keep your hands away from your face until the hands are washed or sanitized, and also the importance of masking. One of the questions that I know people out there are saying, and that is, they wonder, when will this be over? When will we get over this pandemic? And I don't think anyone has the exact answer to that. What will it take, Dr. Mire, for the community and for the country to go back to some semi-normalcy as it relates to this pandemic? Would you say testing will play a major role there? Or would it be, of course, the development of an effective antiviral drug possibly? Or would it be vaccines?
All of the above, Mr. Mayor, all of the above. I think if you look at the timeline here, let's go to vaccines at first. We are, as everyone is hearing from the experts, we are at least a year away from a viable vaccine. And a year and a half would still be phenomenal time frame to get a vaccine, but it's certainly not good enough for us right now in the situation we're in. So vaccine will be great if we get there, but we can't count on a vaccine. And certainly with medicines, that we can talk about all the medicines they're trying and throwing at this virus. And but the truth of the matter is, we don't know. We don't have a medication yet. But I certainly believe that if any country or any around the world, if there's ever going to be medicines that are going to be produced for this virus very rapidly, it's going to be now, because everybody's put their efforts and their resources into that. And if we could at least get through the summer into the fall, when of course everyone's hearing now that there most likely will be a second wave of this virus when cold and flu season hits, if we can at least get to where there are some medications that can be safely used to lessen the burden of the virus, so that may reduce hospitalizations and reduce the risk on our more vulnerable population, then I do believe that there's a good possibility of us getting there. But again, we don't know that yet. So then it brings me to the third level here, and that's what we do now. And you mentioned testing, and of course I mentioned this in a newspaper article last week. But testing right now is for that we've been utilizing is for the active infection, right? That's the infection in your system now, so it only picks up on patients that have active virus in their system. That testing at the beginning, back in late March, was taking sometimes 7 to 14 days to get results. I know, Mr. Mayor, you waited a long time for yours, and it's grueling and painstaking to wait for a test, I know. And so thankfully we have gone through the process here in the last few weeks, where we have our labs getting results back within 24 hours for us, and that's wonderful news. So that's but the next step in the process of finding out how our population is going to do moving forward is to really to see how much of our population has been exposed to this virus and then may have developed some immunity. And that testing is using the antibody testing. Antibody testing doesn't measure for active virus. What antibody testing measures is for testing to see if your body has been exposed to the virus and had enough time for its immune system to look at that virus closely and develop antibodies against the virus. That means an immune response to be able to fight it, sort of like a special forces of white blood cells to help fight against that virus. And so we have a way to test that to see if someone is either clearing the virus late in the infection or early recovery, which is called IgM, or a few weeks to a month and beyond, which is called IgG. And so we can measure to see, and moving forward, there's several applications there, Mr. Mayor, that can be used, that test can be used for, not only just out of curiosity to see how many people we have that were infected, but if you have IgG antibodies a month and 2 months, 3 months down the road, that we can't guarantee, but we can say it with the history that we know in other viruses, including the flu and other coronaviruses. If you have IgG antibodies in your system, then you will have some element of immunity to the virus. We don't know how long. We hope a year. We hope longer, but we definitely think that it'll be some immunity, some resistance to being able to develop the sickness, and more importantly, too, moving forward, is less likely to be a carrier and a spreader of the virus. So the applications there for someone who can say they have IgG could be getting people back to work, getting people in employees back to work. As restaurants come up with their new scheme to open up, the hospital and the healthcare workers being confident when they're around potential cases that they may have already been exposed. We need to know who those people are, and we need to incorporate some form of mass testing in our area and across the country that is safe and effective, that can give us an idea. That can just be another added element of knowledge for us to be able to help people get back to some normalcy.
So basically, the message to the citizens, we're going to be practicing what we've been doing for the past couple of months in respect to this pandemic, and that's social distancing, the importance of hand washing, and carrying on all of the aseptic things that we've been doing in order to reduce the spread of this virus until we can get improvements of testing people. Of course, when we get some type of antiviral drug, if one can be developed, are vaccines.
That's right. These habits that we have been forced to take on as a community and as a country, as a world, are habits that we really do need to incorporate into our daily lives moving forward. I hope to say that eventually they don't have to be this restrictive, of course, but it's only a good thing coming from a medical perspective. It's only a good thing that we practice this sort of hygiene moving forward. And look, Mr. Mayor, and even this week and next week, I know that you're the COVID-19 task force, and I'm also involved with the Economic Recovery Task Force, as Natchez Inc. is putting together. We understand that the small businesses in our area, including the non-essential small businesses, are going to have an opportunity to get going again. And I know you want that to happen, and I want that to happen. But we don't want it to happen without a really good, structured, comprehensive plan that people feel safe with, not just the employers, but our members, our community, so that we can get us back buying local, being able to utilize our resources locally. But we have to have this game plan, and the game plan has to be those things you mentioned. It has to be hand hygiene, has to be continued social distancing, it has to be mask wearing, and not only for the employers, not only for the folks, the employees working at the stores, but also I really have to stress this. Our community has to continue to wear these masks, whether you want to or not. You're protecting yourself and others by wearing them. If employees at businesses are going to wear them, then we need to wear them too. This is a moving plan, right? This is a living, breathing plan. So for now, we have to put some of this into play that's going to feel a little more restrictive, but we need to welcome the restrictiveness of it if we can get businesses open. And as we go down the next several weeks, this will morph and change, hopefully, into something a little less restrictive that we can live with. What do you think, Mayor?
Well, Dr. Muir, I really appreciate you. I mean, you've been truly an asset to our community. You've been the medical voice and the resource that has actually helped the task force develop the necessary guidelines that we put out there to the community. So you, along with all of the other medical professionals and staff members, played a very critical role in this community. And I just wanted to say, as mayor of the city, thank you, and thanks to all of the medical professionals and staff members, all the way down to the custodial staff at the medical facilities for what you've done for this community and continue to do for the community. Leon, do you have any questions, or do we get any callers with any questions for Dr. Muir before he gets off this call?
No, we did not, Mayor. And thank you, Dr. Muir, for being on.
It was my pleasure. Thank you for having me, and I'm going to accept that gratitude on behalf of every one of the folks you just mentioned, because I'm happy to be a voice, and I'm proud and honored to be a voice for the medical community that's worked so hard through this and continue to work so hard.
You know, Dr. Muir, this is coming towards the end of my term as mayor. As of July 24th, I will end my term as mayor of the city. And one of the coincidence is that when I first got elected to public office 22 years ago, and I don't know what made me do it, but I wrote an article that was published in the Natchez Democrat on a famous, I would call it a semi-pandemic. It was more of an epidemic, and that was actually bubonic plague. So I actually wrote an article explaining that particular disease and how it had spread, and how, it had, hundreds of thousands of people during that pretty tumultuous time of that disease. And here it is, before I can leave office as mayor, I'm facing a pandemic before I leave office. And I thought about that about a month ago, that I had written that article many years ago, not knowing that I would actually be faced with a pandemic of a disease before I left this leadership role. And it sent chills down my spine. But thank goodness that doctors today don't have to wear the attire that the doctors wore during the bubonic plague. I'm sure you're familiar with how they dressed back then. They actually looked like birds because they would put all kinds of spices and herbs down those long masks in order to try to protect them, because they actually believe that bubonic plague was caused by quote unquote bad air. They really didn't understand bacteriology, that it was actually caused by Yersinia pestis, that pesty bacteria, which is actually still alive today, but we don't have epidemics of it anymore, only little small endemics of it. But again, Dr. Muir, thank you so much for being on the show today, and God bless you and your family, and God bless Natchez.
I agree. I thank you for having me.
All right, and thanks to my audience out there for listening today. We had Dr. Blaine Mire, who thoroughly explained the COVID-19 pandemic to you. And God bless you. God bless Natchez Adams County and the greater Missoula area. God bless us all. Thank you.
All right, guys, that's it.
Guys for having me.
Thanks, Dr. Muir. We appreciate you.
All right, thanks, Dustin.
No, for sure.
All right,
No,
guys.
Hey, Mr. Mayor. So hopefully you're going to get that information from the other task force to look at it. Let me know what you think about it.
Okay, I have not received it yet, but I've been looking forward to it. Thank you, Dr. Muir. We really appreciate that.
I told them that I really wanted to make sure that both of those were aligned. Those needed to be aligned together. It needs to be one voice.
We're on the same page.
Yes,
I
sir.
totally agree.
Thank you.
Sir.
All right, be safe.
All right, thank you.
I'll see you later.
All right.
Trying to get off. Go now.